Rusty Selix, California Council of Community Behavioral Health Agencies. We commend your staff and the OAC for bringing this issue to the attention. With its core purpose of helping the adults and older adults with severe mental illness who are at greatest risk of homelessness, incarceration, hospitalization, there's only one problem: we don't have enough money. That was actually the hardest part of Prop 63. The mental health community isn't known for having deep pockets.
Rusty has spent a lifetime of advocating for people in his entire career. He's given voice to those who don't have one, and he's spent so much time looking for areas that need improvement and looking for areas that he can work on to make the lives of other people better.
It's one of the most devastating illnesses there is, but it's one that we can do a lot about. The obvious need for research to develop, hopefully, a cure, but the very least things that can manage our lives better, and those things are in development. Equally important is the day-to-day life. You learn once you have ALS that you have to live one day at a time. And while the disease progresses and what I need changes, the need to look at each day of what can I do, what can't I do, how to make the best of what we have is so important. I remember that Fred Fisher and Fred Noteware took me to lunch, and they told me what they wanted to achieve, and they told me, how they thought I could help.
We're here today for a budget request because the numbers of patients who have ALS are growing in California. The caseload is growing for a couple of reasons, and the association, which provides so many essential services to people who've been diagnosed with the disease, is not able to keep up with that growing demand.
Philanthropy by and from the ALS community cannot keep pace with the growing demands for services and support. Those living with this disease need the state's help in underwriting the system of care that will enable the scientific community to pursue progress while enabling the 1 in 400 who will be diagnosed the opportunity to benefit from the only treatment that will help them live longer and better.
I realized that what they were wanting for ALS was exactly what I've been doing every year for the last 20 or 30 years for mental health. So I said, yeah, I know I can help. Mr. Chairman, Rusty Selix, a patient with ALS. This time last year and each of the previous 30 years, I came before this subcommittee testifying on behalf of people with severe mental illnesses. Every month, we have a new challenge of something that we used to be able to do that we can't anymore. And how do we manage our life, and how do we adjust based on that new challenge? This ALS clinic model, where every 3 months we see the clinic team of, 6 people see us over a 3-hour visit. When I first started getting those benefits last summer, I had no idea that it wasn't all covered by insurance. It was only when I learned that philanthropy. So I thank Fred and I thank the ALS Association for making this care possible, because right now I'm benefiting from it. Nancy is more than just the love of my life. She is the most amazing person, and I never thought there could be somebody who could love me and make me enjoy life the way that she has. I just never believed you could have that kind of a relationship with somebody so wonderful. I'm so proud and so happy for all 3 of my children. Amy, my oldest, and her fiance Ryan are both school teachers and doing amazing things. And Shay, my son, so brilliant and capable. And my youngest, Sydney, she's, I guess, the one most like me.
Rusty's a deadhead, just like I am. We both love the Grateful Dead, and that's one of the things that really drew us to each other. Our interest in the band and the music and the deeper level of it. And one of the things I said to Rusty when I first met him was, there's a line in a Grateful Dead song for every situation in life.
People have often told me I'm the most optimistic person they've ever met. I get told that a lot more now than I ever used to, and obviously living with this illness makes it much, much harder, but somehow my spirit remains strong, and I feel so lucky that I have that within me. I think it's a great way to live, and I hope I can inspire my kids and other people to try to focus on the positive, and you can enjoy life a lot more that way.
This would be a great idea and a great complement to the Oversight Commission's report and their triage system and other funding to establish this program. So we strongly support this recommendation.
Mr. Selix has spoken. It's a great idea. Thank you.
This is an incredibly important thing for those of us with this very, very serious disease, and so I hope that you will look positively on this funding request.
I just wanted to add my 2 cents. You have been a champion for mental health. You are also a champion now for ALS. Thank you for adding your voice and your advocacy to this.
Thank you, and thank you for your leadership. And so when you put it all together with my great career and the love I have from Nancy, I just feel like, wow, am I lucky.